Hello everyone and welcome to our presentation on Tricare physical therapy coverage. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance education and consulting firm specializing in physical, occupational, and speech therapy. We offer regularly scheduled live, full-length continuing education courses, and we have a large library of recorded compliance and clinical courses. The website contains guides, sample forms, and policies on Medicare, Tricare, HIPAA, NCCI, OSHA, and other important federal laws. We are working on PT, OT, and SLP compliance guides for all 50 states, along with therapy-related information on Medicaid, workers' compensation, home health, facilities, early intervention, school-based services, and other relevant state laws. We offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. We also offer credentialing services, claims appeals, and billing support, compliance audits, and more. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. So we'll start here. This is the code list of physical therapy covered codes. This list is from their manual, but it's actually very outdated. You should assume that any service that's covered by Medicare is going to be covered by Tricare unless it's one of the non-covered services that we'll talk about towards the end of the webinar. Just in general though, Tricare covers physical therapy services to aid in the recovery from disease or injury, to help the patient in attaining greater self-sufficiency, mobility, and productivity through exercises and other modalities intended to improve muscle strength, joint motion, coordination, and endurance when prescribed by a Tricare authorized provider. So the authorized prescribers are going to be physicians, certified physician assistants working under the supervision of a physician, a certified nurse practitioner, or a podiatrist. Chiropractors, for the record, are not Tricare providers, and chiropractic services are not covered under Tricare, so if your referral is from a chiropractor, it will not be valid. So the medically necessity for physical therapy services. Benefits are payable for inpatient or outpatient physical therapy services that are determined to be medically necessary for the treatment of a covered condition and that are directly and specifically related to an active written regimen. Services which have demonstrated to be capable of reliably confirming the severity of impaired function attributed to a physical impairment may be cost shared when medically necessary and appropriate. Services or items which have demonstrated to be usually capable of reducing or arresting the severity of impaired function attributable to a physical impairment may be cost shared when medically necessary and appropriate. Services must be professionally administered to aid in the recovery from a disease or injury, to help the patient in attaining greater self-sufficiency, mobility, and productivity through exercises and other modalities intended to improve muscle strength, joint motion, coordination, and endurance. Physical therapy services consist of the physical evaluation of a patient by muscle testing and other means, and the prescribed therapeutic treatment and services of a definite and functional nature. The treatment by physical means, hydrotherapy, heat, or other similar modalities, physical agents, biomechanical and neurophysiological principles, and devices to relieve pain, restore maximum function, and prevent disability following disease, injury, or loss of a body part. Physical therapy to improve, restore, or maintain function, or to minimize or prevent deterioration of a function of a patient when prescribed by a physician is covered in accordance with the rehabilitative therapy provisions. For rehabilitative programs, while a patient is under a restorative rehabilitative therapy program, the skilled provider should reevaluate his or her condition when necessary and adjust any exercise program that the patient is expected to carry out himself or herself, or with the aid of family members to maintain the function being restored. By the time it is determined that no further restoration is possible, for example, by the end of the last restorative session, the provider will have already designed the maintenance program required and instructed the patient or family member in carrying out the program. Where a maintenance program is not established until after the restorative rehabilitative therapy has been completed, it would not be considered medically necessary and appropriate medical care and would be excluded from coverage. So maintenance programs require the specialized knowledge of a skilled provider that may be required to establish a maintenance program intended to prevent or minimize deterioration caused by a medical condition. Establishing such a program is a skilled service. The initial evaluation of the patient's needs, the designing by a skilled provider of a maintenance program which is appropriate to the capacity and tolerance of the patient, the instruction of the patient or family members in carrying out the program, and infrequent evaluations may be required. So documentation requirements are not specified in the therapy manuals, so you don't have something like that tells you how to do an evaluation, plan of care, or anything like that. So you're actually going to stick with your state rules when it comes to documentation for Tricare. So those are the most important. There's any other thing that's for standards of medical practice, information from the APTA, anything like that. You're definitely going to want to do an evaluation, a plan of care, treatment notes for each day of treatment, and a discharge summary. You don't need to keep a progress note like Medicare, but it is a good idea to do that if you do a reevaluation for that documentation to be valid. So again, Medicare documentation requirements are not necessary. Look to your state board rules for what they require for documentation, also the APT documentation best practices, and it really should include an evaluation, a plan of care, treatment notes for each day of service, and a discharge note and a reevaluation if applicable. So all entries in medical records, including paper-based and computerized or electronic records, must be dated and authenticated, and a method must be established to identify the authors of the entries. So now for PTAs. So many of you know Tricare did not cover assistance services until April 16, 2020. And the rules will follow the Medicare rules. So PTA shall meet Medicare requirements for qualifications required by the requirements, which actually basically just means they need to be licensed or certified in their respective state. So PTAs, the scope of practice, they're going to work within the requirements of the state. PTA shall not perform the following: the initial examination, the evaluation, reevaluation assessment. They cannot establish a diagnosis or the plan of care. So as of now, supervision is going to follow the Medicare rules. So direct supervision, it requires the supervising PT be in the office suite where the PTA is located and immediately available to furnish assistance and direction throughout performance of the services. The PT is not required to be in the room with the PTA while the services are performed. General supervision means the services are furnished by the PTA under the PT's overall direction and control, but the PT's presence is not required during the performance of the services. Under general supervision, the training of the assistant who actually performs the services and maintenance of necessary equipment and supplies are continuing responsibility of the physical therapist. So in the private practice setting, same as the Medicare rule, direct supervision is required. So a licensed registered physical therapist is considered to be a private therapist in private practice if the physical therapist meets the following requirements: legally authorized to engage in the private practice of physical therapy by the state in which he or she practices and practices only within the scope of their practice, engages in the private practice of physical therapy on a regular basis as an individual in one of the following practice types: a solo practice, partnership, or group practice, or as an employee of one of those, and who bills Tricare only for services furnished in his or her private practice office space or in the patient's home. Private practice office space shall be owned, leased, or rented by the practice and used for the exclusive purpose of operating the practice. A patient's home does not include any institution that is a hospital, critical access hospital, or skilled nursing facility. So for institutional providers like an CORF or outpatient rehab facility or a skilled nursing facility, you're going to general supervision is allowed. So for home health services, in addition to the requirement for general supervision, the licensed physical therapist shall provide the ordered therapy service at least once every 30 days to functionally reassess the patient and compare the new measurements to the previous measurements. So in a CORF, physical therapy services require that the PT be on premise of the CORF or shall be available to the PTA through direct telecommunications for consultation assistance during the CORF's operating hours. So for rehabilitation agencies, in addition to the requirement for general supervision, the following requirements also apply. The licensed physical therapist is present or readily available to offer supervision when a PTA furnishes services. If a licensed PT is not on the premises during all hours of operation, patients are scheduled so to ensure that the therapist is present when special skills are needed, for example, an evaluation or reevaluation. When an assistant provides services off the organization's premises, those services are supervised by the licensed PT, makes an on-site supervisory visit at least once every 30 days or more frequently if required by the state. So for reimbursement, professional services provided by a PTA meeting applicable supervision requirements and billed under the CHAMPUS maximum allowable charge shall be billed under the Supervising Licensed Therapist National Provider Identification Number, or NPI. When assistant services are provided under the supervision of a licensed PT and NPI number, the licensed PT certifies that the claim is accurate, all documentation to support the claim has been completed, and that the services were provided by the therapist or that a assistant provided the services under the supervision as required. So the CQ modifier is required. So outpatient physical therapy services furnished whole or in part by a PTA shall be billed using modifier CQ. A service is considered to be furnished whole or in part by a PTA when more than 10% of the service is furnished by the PTA. So in accordance with Medicare's guidelines, furnished in whole or part means that the PTA either furnishes all the minutes of services exclusive of the PT or furnishes a portion of the services separately from the part furnished by the physical therapist, such that the minutes for that portion furnished by the PTA exceeds 10% of the total minutes of that service. And you remember with the Medicare rules, you're going to look at it on a unit by unit basis when you count time. Effective for services rendered after January 1st, 2020, you're going to see the 15% reduction as well, like in this Medicare. So the time count is the time the patient is treated. If a particular therapy requires both a licensed PT and PTA for one time interval, or two PTs or two PTAs, only one code shall be separately submitted for that time interval. So now these are the services that are not covered under Tricare. Diathermy, ultrasound, and heat treatments for pulmonary conditions, general exercise programs even if recommended by a physician or other authorized provider, electrical nerve stimulation used in the treatment of upper motor neuron disorders such as multiple sclerosis, separate charges for instruction of the patient and family in therapy procedures, repetitive exercise to improve gait, maintain strength and endurance, and assistive walking such that is provided in support of feeble or unstable patients. Range of motion and passive exercises which are not related to the restoration of a specific loss of function but are useful in maintaining range of motion in paralyzed extremities. Maintenance therapy that does not require a skill level after a therapy program has been designed. Services of chiropractors and naturopaths, whether or not such services would be eligible for benefits if rendered by an authorized provider. Acupuncture with or without electrical stimulation. Athletic training, evaluation, or any of the athletic training codes themselves. Continuing on, sensory integration therapy, or 97533, which may be considered a component of cognitive rehabilitation, is unproven. Non-surgical spinal decompression therapy, decompression reduction stabilization, vertebral axial decompression provided by a mechanical or motorized traction for the treatment of low back and or neck pain is unproven. Low-level laser therapy, also known as low-level light therapy, or cold laser therapy for treatment of soft tissue issues, pain, or inflammation is unproven. Spinalator therapy and use of a spinalator table for the treatment of neck and low back pain. Spinalator therapy is defined as a type of traction that uses the patient's weight to create traction force in the absence of any external pulling force. The spinalator table is defined as a table with rollers that applies consistent pressure and movement under the patient, absence of any external pulling devices. And TENS, or transcutaneous electrical nerve stimulation for the treatment of acute, subacute, and chronic low back pain, is excluded for coverage. Physical therapy visits when the sole treatment provided is TENS for lower back pain are not eligible for cost sharing. Separate charges for TENS therapy provided during the course of otherwise covered physical therapy are not eligible for cost sharing. And TENS units for home use prescribed during the course of physical therapy are also not going to be covered. Dry needling is also not covered. It's considered unproven. If a physical therapist provides dry needling in the course of an otherwise covered physical therapy session, Tricare may cost share the cost of the covered care, not separate reimbursement for the dry needling. Visits for the sole purpose of dry needling are not covered. Thank you for joining today's presentation. If you liked it, please like and subscribe. We'll be adding a lot more videos in the future. And please visit us at therapycomply.com. I have a whole section of Tricare information, which includes enrollment and other important information about coverage, appeals, and things like that.